Okay, conjunctivitis overview. Description. This is an overview of many different forms of conjunctivitis. They're covered in more details in individual articles in this book. Conjunctivitis is a non-specific term signifying inflammations of the conjunctiva with dilations of the conjunctival blood vessels, giving the characteristic red eyes appearance. One of the main features distinguishing between acute bacterial infections and other causes is its chronicity. Chronic conjunctivitis, lasting longer than 2 weeks, is uncommon with bacteria and simple viral infections. Cause. Conjunctivitis occurs in a number of pathological conditions. Infective could be bacteria, acute, hyperacute, and chronic. Viral, including adeno, herpes simplex, or molluscum. Chlamydia, ophthalmia neotorium, trachoma, adult inclusion conjunctivitis, and lice, psoriasis palpebrarum. Allergic, seasonal, giant papillary, vernal, and atopic. And ocular surface disease, blepharitis, keratoconjunctivitis saccade, from Sjögren's syndrome, lacrimal and lipid layer abnormalities. Could be immune from Stevens-Johnson syndrome, toxic, drop sensitivity, chemical injury and photokeratopathy, mechanical, eye rubbing, mucus fishing syndrome, artifactual conjunctivitis or contact lens use. Symptoms. The patients present with red eyes and may also have noticed a purulent or watery discharge. A watery discharge is associated with a viral conjunctivitis, while a purulent discharge is associated with a bacterial infection. Chlamydia conjunctivitis can have a mixed presentation like bacteria or viral. Both of these conditions tend to be unilateral initially, then bilateral, although herpes simplex disease tends to stay unilateral. A foreign body sensation is common with most causes of conjunctivitis, although each would tend to suggest an allergic etiology. Signs. Follicles consist of lymphoid hyperplasia within the palpebral conjunctival stroma, more pronounced inferiorly. Clinically, they appear as multiple small grains of rice embedded in the tarsal conjunctiva. There are surrounding accessory blood vessels. Possible causes include viral or chlamydia infections, as well as a hypersensitivity to topical medications. Papillae are focal elevations of the conjunctiva, particularly on the superior palpebral, and are best highlighted on the lid eversion by using fluorescein. Papillae consist of central blood vessel with conjunctival epithelial hyperplasia and stromal edema. There are also be a diffuse white infiltrate of chronic inflammatory cells. Giant papillae are greater than 1 mm in diameter. Conversely, normal papillae can occur on the superior edge of the tarsal plate. Papillae can occur in bacterial conjunctivitis, blepharitis, atopic conjunctivitis, giant papillary conjunctivitis, and vernal conjunctivitis. Members of membrane or pseudomembranes consist of coagulated exudate, firmly or loosely adherent to the conjunctiva. Acute bacterial conjunctivitis should be considered adenoconjunctivitis among others. Discharge and hyperemia. Chemosis is the term given to subconjunctival edema and is seen especially with acute allergic conjunctivitis. Subconjunctival hemorrhage. Multiple small hemorrhages can occur in viral and bacterial conjunctivitis. Scarring an uncommon sign in developed countries, but considered trachoma occur cicatricial pemphigoid. Keratopathy associated corneal infiltrate may be seen with some infective forms of conjunctivitis such as chlamydia and adenovirus. Management. Treatment range from advice for simple viral conjunctivitis through to biopsy and treatment with systemic immunosuppressive agents for ocular cicatricial pemphigoid.